Okay, welcome everyone. Thank you for joining us for Parasites 101. I'm Dr. Shawn Prasad, and I want to start off by telling you a little bit about my story, because I started off early in life with my own parasite story, and it's actually also the story behind why I got into holistic medicine in the first place. So at age 3, I was diagnosed with a severe generalized anxiety disorder. I was having panic attacks almost daily. They were unexplained. They weren't triggered by anything obvious. No distinct pattern to it, aside from the fact that I was having issues daily that were quite debilitating. Um, my mom, for like the 10 years that followed, basically was taking me to doctor after doctor, repeated medical visits, and no answers. Okay, no answers, no solutions. And so it was a pretty rough time. When I was about 14 or so, we had a family friend that introduced us to a holistic practitioner who was able to resolve the issue in one visit. So not only that completely changed my life, but it really inspired me to get into this field. And, I never looked back, right? And so it was very interesting because at the root of the anxiety disorder, which is something that's usually thought of as a mental health issue, right? And that's how the conventional mainstream way of looking at things, is, back then and, to a very large extent, still now. Um, but it turned out that I had a very bad parasitic infection. Okay. And so once that got treated, things got good, very quickly. The anxiety went away. I had no more panic attacks, no more pain in the stomach. I was getting lots of stomach pains every morning. All of that went away. And so it's just to show you parasites, and mental health do have a link, right? There is a physiological basis for some of these conditions that are often just kind of, thought of as a mental health related thing. So um, that's something that really caught my interest. And this is one of the reasons, too, that this topic is so interesting to me, and it's something that I care about deeply. Um, so that being said, I'm really excited to share this presentation with you guys, and let's move on here. So we're going to talk a little bit about me and Yasmin and what we do. We're going to talk about, most importantly, the topic for today, parasites, how they spread, the kind of common symptoms that are associated with parasite infections, the type of testing that's available out there. We'll talk to you about the kind of testing that we use at our clinic. The remedies, which is probably the thing that everyone here is most excited about. How do we kill those parasites? So we have a good section on that. And then we're going to talk about prevention. So let's move on. Before I get into the juice of it all, quick disclaimer. Please note that all the information that we share in this webinar and the accompanying handout is for personal reference only and isn't intended to take the place of sound medical advice from a qualified practitioner. It's your responsibility to seek appropriate medical guidance for any health conditions you have, and we will not be taking any responsibility for your health choices under any circumstances. Also, please note that the material here is copyrighted, so it should not be reproduced by anybody or distributed unless you ask us for permission first. Okay, and then we'd be happy to help out. Alrighty, so me and Yasmin both work at the Center for Holistic Healthcare and Education. That is our clinic. I founded that clinic back in 2013. And then Yasmin joined along. She's also my partner, and we help sick people heal from complex issues. That is what we do. And as a doctor of natural medicine, basically, we focus on holistic and natural approaches to healing. Okay, so we use non-invasive methods like orthomolecular nutrition, which is basically nutritional science. We use supplements, we use food as medicine. We also use tools like energy medicine, lifestyle changes, mind-body techniques, and so on. Okay, so we try to use as many different natural tools as possible to help get the best outcome. Um, Everything we do, is designed to help support the body's natural ability to heal itself. And above all, our primary aim is to address the root causes of illness rather than just treating symptoms. Okay, so that is really what holistic medicine is all about. Now, to that end, one of the most important techniques that we use in our clinic, and it's one of the things that really differentiates us from other types of healthcare practices, is muscle testing. Okay, so muscle testing is a technique that's used in holistic medicine to basically assess the body's state of health and any imbalances that could be found at a physical level, an emotional level, or even an energetic level. It involves gently applying pressure to a muscle. So you'll see in the photo here, I'm testing a quadricep muscle. Okay, so I'm basically applying pressure, the patient's resisting, and we have basically the goal here of testing the muscle's response to different forms of stimuli, such as foods, supplements, neurological reflexes, or even emotional factors. In this particular photo, you'll see that the lady is making contact with her index fingers to her eyes, which is a type of neurological reflex. So I was doing, a neurological reflex test in this particular instance. Um, but anyhow, um, essentially here, what we're looking for is the strong or weak reaction of the muscle, okay, which would indicate for us a positive or negative test result, okay? So at the end of the day, this can be used as a feedback mechanism to identify underlying causes for health issues, and also, perhaps even more importantly, the best course of action as far as treatment is concerned. So, one of the biggest issues that practitioners from all fields of healthcare face is, when you have a case, usually, or not, I mean, not necessarily, but in many cases, it can be pretty complex. People don't often have just one issue. It can be, a combination of things that are going on for them. They can have multiple symptoms, and things can get a little bit confusing, especially, trying to figure out where to start. So, who better, to ask than your own body, right? And muscle testing allows us to have this communication pathway between your brain, your body, and the muscle to give us feedback as to the best course of action to treat your condition. So it's quite remarkable. Um, the other thing I want to mention about it is something that even though a lot of people don't know about it, it's actually been in use for over 60 years. In fact, this year marks the 60th anniversary that the International College of Applied Kinesiology was founded, okay, which is the college founded by Dr. George Goodhart, who really brought muscle testing and put it on the map. He really developed this technique in a major, major way and opened up this college to train doctors from all fields and all specialties to use it professionally in clinical practice. It is something that's been around for a long time, so has a very strong scientific basis for its clinical applications. So, um, yeah, and we're trying to also work on material to post on our website and social media to kind of show demos of what this looks like and kind of give more scientific based information on how it all works. All right, now, as I mentioned earlier, some of the kind of tools we use once we kind of figure out what's going on with people. So, is basically things like orthomolecular nutrition, which is essentially nutritional science. We're using food, we're using medicine, we're using food as medicine, we're using supplement as medicine to help heal the body. We're also using tools in our clinic such as energy medicine, mind-body techniques, and also gentle forms of manual therapy like cranial sacral techniques, osteopathic techniques, and so on. Here we've got some happy clients. All right, so now when it comes to parasites, a lot of people want to know, signs and symptoms and all that kind of stuff. So we're going to start here. All right, read through what you see on the screen here. We've got everything from mystery symptoms, okay? Basically, these are collections of symptoms that a doctor can't even put a diagnosis to because it's just kind of so unusual or just doesn't fit any particular diagnostic kind of pattern, if you will. We've got autoimmune diseases of all types. We've got skin disorders, eczema, psoriasis, rashes, even like the idiopathic type, where there's no kind of known cause for them. This can also sometimes express itself as hives and stuff like that. Um, we've got fibromyalgia, arthritis, allergies, migraines and headaches, vertigo, chronic fatigue, hormonal issues, diabetes, cholesterol problems, blood pressure issues, infections of all sorts, okay, so not just parasitic, anxiety, depression, addictions, and so on, cardiovascular issues, chronic pain, sport injuries that aren't healing, and obviously the digestive issues, okay? Now, most people associate parasite infections and things like that with just the digestive part. But what I want to bring to your attention here is it's not just a digestive issue. You can have parasites, first of all, anywhere, almost pretty much anywhere in the body. It could be in, and we're going to talk about that later, but it can be pretty much anywhere in the body. And so you can get symptoms almost anywhere in the body. Not only that, but intestinal parasites, they're extremely common, maybe the most common. But as some of you may know, the digestive system, is connected to just about everything else, right? So when you have a very unhealthy gut situation, inflammation in the gut, infections in the gut, that can affect your nervous system, it can affect your brain, it can affect your skin, it can affect a lot of things, right? So it can create a chain reaction of problems that create all of these other kind of diagnostic conditions that we have listed here. So if you have any of these conditions, it does not mean necessarily that you have a parasite infection or that a parasite is causing that condition. But what we have found in our clinical practice is that most people with these conditions, at some point in the whole treatment process, we do discover that they have parasites. Okay, so it's not going to be everybody, but a lot of people have parasites with these conditions. And when we do treat them, it tends to make a pretty significant difference. We see symptoms improve drastically. Now, this is very significant because when you think of the conventional way of looking at any one of these, parasites is usually not even in the question, okay? Including the digestive issues, which is very surprising. And that's one of the reasons actually we decided to put on this webinar is because there's a massive gap in our healthcare system. All right. Most people, if you've dealt with our medical system, the talking about parasites has probably never even come up. Okay. And if you were kind of heard about it somewhere or did your own reading, maybe asked your doctor about it, they might have rolled their eyes at you or just kind of, brushed it off or whatever. At best, if they kind of went along with it, they might have done a stool test just for it to come back negative, and then they just kind of blow past it and move on, right? So there is a huge gap in our healthcare system when it comes to understanding parasites and when it comes to more advanced technology to test for them and all of that sort of thing. And it's a big reason why this connection hasn't really been made in the mainstream. One of the reasons they don't investigate this further is literally because of an assumption that first world countries do not get parasites, right? And this couldn't be further from the truth. And so anyhow, that being said, let's move on to describing what parasites actually are and learning a little bit more about them. Okay, so these are the critters that we're dealing with, all right? These are our target species today, the parasites. And there's three main kind of classifications, if you will. There's the ectoparasites, which are small but visible types of parasites, and they're usually located outside of the body. Okay, as an example here, a mosquito could be considered an ectoparasite, like an insect or what have you. So that's one type. All right, now the types that we typically treat in clinic are the other two. All right, so the helminths, okay, which include trematodes, cestodes, and nematodes, right? Those are the kind of, if you worked with me, you might have heard me call these names out before. So these are different species of parasite within this group. All right, now these ones you'll find inside the body. You can find them in the digestive system, you can find them in the stomach, the small and large intestine, the liver, the gallbladder, the lung, the bladder, the muscles, right? So as I said before, you can find these things all over the place. Um, so yeah, moving on, the protozoa, these guys are more or less microscopic. Okay, so you're not going to see them. They're not going to be visible in your stool or anything like that. They're microscopic. So you need a microscope to actually see these guys. No, it doesn't mean that they're not as bad as the visible type. Okay, which by visible, we're talking about the helminths, and they can be anywhere from like a millimeter long to several feet long. Okay, so there's a lot of variety in that group. Um, but it's not a matter of the bigger it is, the worse it is kind of thing, because microscopic parasites can be quite devastating. So um, these ones too, obviously found inside the body, and they can be also found just about anywhere. Digestive system, they can be in your blood, they can be in the brain, the eyes, again, the muscles, the lymphatic system. Again, just about anywhere we can find these protozoa. Okay. Whoops. So here, I know you're not going to be able to read this, but the whole purpose as to why we wanted to put this slide together here is so that you can really understand and see that there is a huge amount of variety in the parasite world. Okay, so just about every line you see here is the name of a species or a subspecies in all of those three categories that we spoke about earlier. Okay, now the reason we want to show you this is because there's a lot of times that people assume that, okay, we have a parasite, what is the treatment? Okay, and when people ask us the question, what is the treatment? Usually what they want to know is what is the supplement that I need to take? As if there was just one supplement for the parasite problem. Okay, now we wanted to kind of really paint the picture that parasites isn't just one problem. It's thousands of them. There's so many different types of worms out there. You can't just think of it as being a single problem that has a single medicine. Okay. Now, the treatment approach can vary quite drastically, even just based off the species of parasite and what they might be responsive to as far as natural medicine. So there's a lot to consider here. Okay. So I hope this kind of paints a picture that's not just a simple kind of take, this is the supplement to take for any parasite issue. All right. Parasites in the news. This is something that, has traditionally been quite rare. So we've been kind of excited about the fact that at least there's a little bit more attention, being paid to this type of issue. These are just some headlines that we picked up over the last few months when we were kind of preparing the webinar. So anyways, it was just a fun and interesting thing that, now it's starting to slowly kind of, hit the mainstream outlets and stuff like that because, prior to this, it was extremely rare they'd ever see something like this in the news. This one here, also just an interesting CT scan where parasites were found all over the place in the muscle tissues and things like that. So yeah, anyways, it's good. It's just good to see that there's a little bit more attention being paid to it because hopefully at some point, the mainstream medicine will kind of catch on a little bit and start investing and developing the technology that's necessary to support the diagnostic work. Because let's face it, that's a massive industry in itself, and most people will be going through their medical doctors when they have an issue. And it would be good if they had the tools to kind of, help people out with this sort of stuff. Okay. So where do we get parasites? Okay, so we've got a little activity here set up for you guys. So let's have a look at the image on the screen. And I want you to take maybe 10 seconds to identify as many possible sources of contamination here for parasites. Okay, so give it a go. See, test yourself, see if you could identify where you might find parasites in, this type of situation. All right, I'm just giving you a few more seconds. Okay, so here comes the answer. All right, pause the video if you don't want to know right away. All right, here we go. So, whoa, yes, okay. So bottom of the shoes, the hands, underneath the nails, the table, okay, the carpet, the toys. So just about all over the place inside of this photo. All right, so a lot of times people, they get super surprised when we tell them, hey, you got a parasite. And they want to know, where the heck did I get this? All right, now just looking at this one photo alone, there's plenty of possible sources of contamination, and even just a simple daycare setting. And then guess what? These kids have parents. Those parents are going to be in contact with those kids, and they're going to get it too, right? So, yeah, let's move on. So in daycare centers and like kindergarten and schools and stuff like that, these pinworms are some of the most common type of parasite that we tend to find. They're very, very contagious, extremely, extremely common. And their eggs, which we have, I think that's in the next slide, but let me see. Yeah, right over here. There's if you were to look and zoom in on the kind of tip or the head of a pin, there's literally 1,000 pinworm eggs that can fit on it. Okay, so again, these eggs, which are what we pick up and what gets transmitted from person to person, they are so microscopic. Okay, you will never see this with the naked eye. And there's a lot of them. So they spread very rapidly, very easily. And this is a slide here to kind of show you a little bit what that kind of cycle looks like. So if you look at the kind of top left, where it says one there, the first step is you come in contact with these contagious pinworm eggs, which, as we saw in the last photo, is not a very difficult thing to achieve. And then step two is, you make contact with, your mouth, your nose, or whatever, where you touch your food and then you eat the food, whatever, but it gets inside of you, okay? Those pinworm eggs eventually hatch in the small intestine, and the adult pinworms, they move along the intestine, they become pregnant at some point in their life cycle, and then they start to lay eggs. Now, they often lay thousands of eggs per worm, and they often do this in the rectal region, so right around the anus. And so this can cause intense itching, lots of scratching, which is the whole purpose, one of the purposes anyways of laying eggs there, is because people will then scratch, get the eggs in their hands and under their nails, and then spread it to other people, okay? But you'll notice even animals and stuff like that, when they get these types of pinworms, which is another source of contamination, by the way, you might find them having itchy, irritated bums, and you might find them scooting along the carpet and stuff like that to try and get some relief. And you'll notice kids will do this too. They'll be kind of scratching at their bums or kind of wiggling around their seats and stuff like that because things feel irritated, right? So that's one of the signs too that we might consider. Okay. So yeah. So anyway, that's roughly what an example of what that kind of cycle of transmission looks like. All right. So here's another little activity for you. So looking at this photo here, could you guess some possible sources of contamination? Okay. So again, I'll give you a few seconds, and then you can pause if you want some extra time before I show the results. Okay, so results are coming. Boom. All right, so we've got again the hands underneath the nails. We've got the fish, the raw fish. Oh no, the sushi. Don't take away my sushi. I can hear you. I know. We've got the mouth, the teeth, and they're going to kiss each other, and then bang, transmission. Okay, so it is what it is, folks. All right, and when it comes to raw meats, undercooked or raw fish, these types of parasites are relatively common. Okay, the group of trematodes. It can be other ones too, but this is a common kind of species that you'll find in there. Another example here of just kind of transmission and how the fish will pick up on these parasites and, if they're not properly cooked and then you eat them and, the whole life cycle goes on again. Okay, a couple more interesting, species here, the nematodes, the cestodes, and all that kind of stuff. And like we said, some of these parasites are, well, all of these in this slide are more visible usually, and the cestodes in particular are the ones that can kind of be, several feet long if it's a really bad one. Okay, like we see in the photo there. All right, another quick activity here. Can you figure out where you might find a parasite in this photo? Okay, so I'll just give 3 seconds for this one because it's by now you're getting the hang of it, I'm sure. Okay, so the kitty litter. Okay, the cat's poop is, passing along parasites, parasite eggs. And by the way, even if you're wearing gloves and stuff like that, these things can become airborne quite easily. All right, so I know this is sounding a little bit of doom and gloom, like you can't avoid this, and that's kind of true. And we'll be talking about, that later and what's important for prevention. Okay. Yeah, so this is one of the common guys here that infect your cats. Another quick quiz. Actually, I don't think that one was a quiz. That one was just to kind of point out that there's also parasites that are transmitted sexually, I think. Yeah, that's what we intended with that photo. Yeah, so that too. Okay. This one is a quiz. Okay. Now you guys are experts. So 5 seconds, find as many parasite contaminated areas as you can. 3, 2, 1. Okay. All right. So again, the hands, the nails, the dog's butt, the water. Okay. This is nature. Okay. And that's our point. Parasites are part of nature, right? So when mainstream medicine makes this wild, absurd claim that parasites don't exist in Canada because we're a first world country, it doesn't make sense, and you can just ask your biology teachers and stuff like that from back in the day and all that. They know, anyone who's an ecologist knows, anyone who studies nature a little bit knows. In fact, we treat some gardeners and they're very well aware, of these types of parasites because they sometimes use nematodes and things as a natural type of pest controller and stuff like that, right? And so this is something that's very well known. Okay, for some reason, just about every other field except our mainstream medical system, but it is what it is, right? But we want you to know they're all over the place. Okay, so it's not a surprise that people get them so often. All right, this one, I don't recall if this was a quiz. Yeah, this is a quiz. This is a quiz. So where do you think? Where do you think? Okay, so by now you already know the grass, just being outside in nature, now they're on the feet. And when we, one of them that's quite common in these kind of grassy areas are these hookworms, which I believe you can also kind of get in certain waters and stuff like that too, rivers and stuff like that. But basically, these hookworms hook onto you. They could burrow into your skin, enter the bloodstream. From there, they make their way to the heart. From there, they get into the lungs. They irritate your lungs on purpose so that you cough them up. So then they end up in your throat, okay? And then you swallow them into your intestines where they start to kind of cause problems in the whole digestive tract. And then they can make their way, wherever else they feel like going. Okay, so I know it's a bit of a gross picture to paint, but it's just to show you a little bit how these critters work. All right. Okay, a couple more little quizzes here. Again, just we want to show you all the different places, right? People, this is one of the most common questions. As soon as we tell people, oh, it looks like you got a parasite, where on earth could I have gotten this parasite? You know, I didn't travel lately. That's pretty much the assumption, right? You know, like you think you'll get it somewhere else. But we want you to know, like you could get that stuff right here in a million different ways, right? So an example here, it's the food. And it's the healthy stuff too. It's the organic, it's the, you know, whatever, produce and all that kind of stuff, your veggies, your fruit, because it just grows naturally outdoors in nature. There's parasites all over these things. Okay, and we import a whole ton of things too. So the idea that, you know, it only exists in other countries, even if that were true, I mean, people travel back and forth so much, and we import so much food from other places. I mean, we would naturally just get it anyways. So anyhow, any way you look at it, they're here and they're all over the place. All right. Final little quiz here. This is a bit of a trick question. Okay, I'll give you 5 seconds to figure out where the parasites might be here. Okay. All right. All right. The parasites in mom and in baby. Okay. If mom's got it, it can get passed along in utero. Right? So babies can be born with parasites, and we've seen many cases like this, and we've treated a whole ton. Okay. Sometimes these babies are born with eczema, they're born with jaundice, they're born with very obvious signs, sometimes even stomach issues, they're vomiting constantly, constantly spitting up, feeding is a nightmare, lots of irritation, getting sick very frequently, so low immune system. But we see this a lot with newborns, and we've treated plenty. And yeah, we've found in many cases those kind of conditions I just mentioned in young babies and newborns were linked to parasite infections that they picked up from mom. Okay, of course it's always mom's fault, right? Um, right. Okay, and then of course, last but not least, travel, right? You can travel and pick this stuff up, you know, from around the world. Right? So basically, let's just remember that we're only human. Okay, we're part of this large ecosystem. These parasites roam the earth as much as anything else, and so you know the chances you'll be in contact with parasites, even on a daily basis, is basically guaranteed. Okay, if you have a pulse, you definitely have a parasite, which is another important point. You already have a parasite. You already have many parasites. They're a natural part of the microbiome. Okay, the microbiome is made up of bacteria. Most of you are familiar with the term probiotics, which are the good types of bacteria, but we have bad bacteria as well that are part of the microbiome. They just don't cause infections because they are being kept in lower populations, though they're being managed. In the same way, we have parasites, and there are good parasites, there are bad ones. In fact, you know, just as a fun fact, there are certain types of therapies that involve giving people parasites, okay, specific types of parasites to help fight autoimmune disease. That's a very common thing, actually. Um, so yeah, we have good parasites, we have bad ones, we have viruses as part of our microbiome. Again, they don't necessarily cause infections or anything as long as they're being kept in check. And we have a whole ton of fungal species, which is super interesting. There's a lot of research being done on fungus and all their benefits and how we couldn't live without them, right? So we can't just think of them in a bad light, okay? We can't just assume every bacteria, every parasite, every virus, every fungus is bad and we need to disinfect everything and, you know, it's important to know that they play a very important role within the ecosystem of the body. All right. So, um, in fact, one of the reasons that so many people in this part of the world have problems with parasites is because we did not grow up with it in the same kind of way that you might grow up with it in, let's say, a third world country. Okay. Over here, everything is so excessively cleaned all the time that we don't actually have the same level of contact that we would in like a third world country. So that lacking that early exposure, the immune system doesn't actually have much of an opportunity to kind of train itself. okay, and make friends with these things and understand them and understand how to keep them in check and whatever. So later on, when you get them, it can be a little bit more tricky to deal with. So anyhow, but yeah, we just want to point that out. You 100% have a parasite already, and like I said, many of them. But whether or not you need to treat them, that's a whole different question. Okay. And we'll get into the whole kind of treatment side of things later. Again, just some statistics here just to paint the picture that there's a lot of parasites out there. All right, so we'll just move on. Okay. Now, like I said, parasites are everywhere. The goal is to lower their population. Okay, so your immune system doesn't get overwhelmed. The only time that a parasite's a real problem is if they overpopulate, if they're allowed to overpopulate and kind of grow out of control, or if they end up in parts of the body where they shouldn't be. Okay, so those are kind of like the two scenarios where treatment becomes important. But otherwise, you know, they can live in harmony with your body and they can often do a lot of good, like I said. So yeah. All right. So now that we kind of covered that, all right, what makes some people an inviting host for parasites? Okay. And we're talking like the bad types in this situation. What makes it so some people just are prone to parasite infections? We treat lots of situations where one person in the house will have a constant parasite infections, but nobody else in the house does, right? And obviously, everybody in that household is being in contact with it, but no one else seems to be affected. Okay, it just seems to be the one person. So, what makes people so susceptible? Okay, well, we tried to create a little bit of an analogy here to help the learning process with all of this. But if you have a weak immune system, okay, so your immune system isn't keeping these parasites or these unwanted guests in check, you're going to have a problem. Okay, it's as if you were going to host a party, but you don't have any boundaries and you give unrestricted access of your home to your guests. So now you have guests going up into your bedroom, and then they say, "Hey, this is kind of nice and comfortable. Why don't I stay here?" Right? So that's not something that you would allow to happen in your own home, and we don't want our immune systems to allow that to happen either. Okay. Um, Slow gut motility. Okay, this means that it's taking longer and longer, in between bowel movements. Okay, so instead of having a bowel movement, at least once a day or 1 to 3 times a day, now you get more constipated. Okay, it can take 2 or 3 days before you have a bowel movement. So the slower that the gut motility is, the less likely you're going to be flushing out these parasites. So it creates a situation where they're not being disturbed as much, right? Not only that, but having a sluggish gut also creates a very toxic environment in the bowels, which is perfect for them. That's what they like. It creates a very good habitat for them, right? So that's again like being a house host, right, or a party host, and being overly polite and not rushing them. So, oh yeah, no, you guys just hang around here. We're not gonna push you out the back door. We're gonna kind of just let you be, no problem, right? And we're going to shelter you from the elements. We're going to keep you super comfortable and, all that kind of stuff, right? So in the scenario, in the biology kind of scenario, having low stomach acid, an imbalanced pH, having all kinds of other microbes causing, all kinds of toxins and stuff like that. For a parasite, that's all great stuff, right? That's all great stuff. They don't have to deal with all the harsh elements of a healthy human body, right? Where the immune system, the strong digestion, the balanced pH naturally will push these things out, okay? And they won't want to stay because they're constantly being bombarded, okay? The other aspect of being a good party host is providing your guests with their favorite food all the time, right? So, of course, why would they want to leave, right? And so parasites are the same. If you're constantly giving them lactose, if you're giving them milk products and dairy, and it's not just the lactose, actually, it's also the milk proteins, right? If you're Giving them sugar, all the processed sugars and things, right? If you're feeding them toxins, preservatives, all the chemicals on foods and whatever else. If you're feeding them toxic metals, okay, even from old metal fillings or, toxic metals from, there's all sorts of sources of toxic metals these days, even tap water and all kinds of things, right? Medications even sometimes are contaminated with these metals and all kinds of stuff. So all of this is food for these parasites. They love that. They love that. Okay. So, you know, these are some of the factors. Okay, these are some of the factors, that make some people a lot more susceptible. If their immune systems are weak, if they have a weak gut situation, if they're eating the wrong foods, all that kind of stuff all adds up. Okay, now on the flip side, okay, the 5 causes of disease video series that we had put together a while ago, it's been a couple of years now that we've had this out. This will go into a lot more depth than what I have time to go into today regarding prevention. But this we have available for free on our website. So I really encourage you to go and check this out. It's a very, very comprehensive series of lectures that I put together, and it'll go in depth on all the things that you need to be focused on to really strengthen your overall health and wellness, to make sure you have the most balanced immune system possible, and you're addressing the things that matter, okay, so that you can be a bad host, okay, at least for these parasites. All right, so go and check that out. All righty, so moving on, what do parasites do to us? Okay, so what's going on, right? Why are we afraid of these parasites in the first place? Well, we talked about, first of all, earlier at the beginning, the type of conditions, the types of diagnoses that we can eventually develop with untreated cases of parasite that kind of really, get serious. At least it can be a contributing factor to it. Like I said before, it's not always the one cause. Most conditions have multiple kind of causes, but this can certainly be a big, big part of it. But I know more specifically, if we kind of break down the pathology here and, how you go from parasite infection into a full-blown diagnosis of some sort, this is, relatively, a good starting point. Okay, so parasites will strategically suppress your immune system. Okay, and they do this in multiple ways. We're not going to get into all of the detail of that, but they will make your immune system weaker. The weaker your immune system, the easier it is for them to survive. This also creates a ripple effect because a weak immune system invites other types of infections. It invites inflammation. It invites all kinds of other stuff, right? And this is even just looking at that alone, you can start to understand here how this might lead into, a full-blown diagnosis of something, okay? They will strategically manipulate your hormonal system, okay? So they will increase cortisol, they will, affect your dopamine pathways, they affect serotonin, which is going to affect your mood. It can affect your sleep, cause anxiety. This is one of the links, by the way, here to the mental health connection that affected me with my anxiety and so many others. And they can create a whole hormonal mess, okay? Even just thinking about the sleep situation, right? They're disrupting your hormones that allow you to sleep, right? And so the less you're sleeping, the less you're healing, the less you're replenishing your immune system, right? So again, this is part of a bigger cycle here. How, you go through years of not sleeping properly and not being able to replenish your immune system and fully heal, you're going to have a pretty weak system, right? And then that sets the stage for all kinds of other types of illness to set in, right? So I hope you're starting to get the picture of, how these parasites kind of do what they do and why it's a contributing factor to so many different types of conditions. Okay, it's like a systemic issue. Okay, and they keep weakening the body, and they make you susceptible to other problems. Okay, uh, so so yeah, okay. Moving on, they damage our tissues. They create inflammation. They damage the bowel. Okay. You damage the bowel tissue, you're going to get worse and worse absorption of your nutrients. So you'll become more and more malnourished. Okay. They also steal your nutrition, right? They steal your nutrition. They make you deficient in all kinds of nutrients like B12 and iron. This is one of the big things behind iron deficiencies. Sometimes people have iron deficiencies, they get blood tests and they're told they're anemic and they have no idea why. How the heck am I anemic? I eat red meat, I do all this stuff, whatever, I'm healthy. Sometimes it's because of a parasite that's eating up your iron. We've seen this plenty of times. We've also seen many cases of anemia where people take iron supplements, but their iron just never seems to build back up, even with high doses of iron. So these are cases where there's parasites that are constantly consuming their iron. So no matter what they do, they can't seem to correct the anemia. Now we see cases like this, we fix them pretty quick once we identify, oh, there was a parasite here that was really the problem. It's not that you have to supplement iron, is that you have to do a parasite cleanse. You got to get these guys out. They're the ones stealing it. And all you're doing when you're supplementing iron, when you're in that situation, is you're just feeding them. You're just feeding them and wasting your money, and feeling worse in many cases. So, um, so again, this also, again, you can kind of start to see you have these deficiencies. These deficiencies lead to other illnesses. Okay. Um, what else here? They release toxins. Okay. And over time, those toxins will damage your tissues. They're going to overwhelm your liver. It can create serious problems with the liver. Over time, you can get like these fatty liver conditions. You can get all kinds of weird stuff happening when you have a very unhealthy liver. You're going to get a lot of health issues. A lot of health issues stem from a liver that's not working well. Okay, hormonal problems, I mean, I could go on forever, right? The liver is one of the most important organs in the body. So, and this is also just as a side note, where you're going to get a lot of allergic type conditions as well. Okay, high histamines, okay, mast cell activation, all this types of stuff, idiopathic hives, all this kind of, thing, eczema on the skin, a lot of skin issues, acne, breakouts. It comes from the toxins that these parasites are releasing back into the system, and that you're not able to detox anymore because you're just saturated and the body's overwhelmed. Okay. Ammonia is a gas that is extremely toxic. It's neurotoxic, meaning it's toxic to the brain and nervous system. Another reason for anxiety disorders tied into parasite infections. Um, it can literally, if you get enough ammonia up to the brain, it can make you suicidal. So it's also a big factor behind depression. And we've seen many cases where people have like snapped out of their depressions once we cleared parasites, right? And that's one of the reasons we get that ammonia out, and they snap out of it. So there's a strong physiological basis for mental health conditions. That's also a whole other topic in itself, and we'll probably do a webinar on the topic at some point. But it's very important to know that, because yes, there is a trauma side to it. Um, and of course, like the experiences we go through can lead to depression, anxiety, and these types of things. But there's also a strong physiological basis as well that is not looked at enough. Okay, but certainly our approach has been very effective, looking and taking in consideration both the mind and the body. Okay. And then we spoke about them causing inflammation and all that kind of stuff. Okay. So yeah, big problem, these guys. All right, so common symptoms here, from head to toe, they can cause you some kind of problem. Everything from anxiety, brain fog, headaches, dizziness, being very reactive emotionally, losing patience, all that kind of stuff, tooth decay, cavities, okay, root canals, um, food cravings. And they always make you crave the foods that feed them. That's why a lot of people have cravings for dairy and the sugars and all that kind of stuff. The raw fish, the sushi, whatever. Chronic congestion, sinusitis, gum sensitivity, a lot of oral health issues. Again, the mouth is the beginning point of the digestive tract, so it's not a surprise. Um, Cysts, okay, cysts, and it could be anywhere in the body. Okay, we have it listed kind of higher up here, but it doesn't matter where the cyst is. It can be cysts in the uterus, ovarian cysts, very common issue with parasites is ovarian cysts. Um, Even things like fibroids and stuff like that. These cysts is one of the ways the body tries to trap the parasite. Okay, so if you're someone who's prone to cysts, this is something you need to look into. Swollen lymph nodes, chest pains, chronic coughs, allergies, heart palpitations, and from all the toxins they release, it will often create heart palpitations, low iron, anemia, gallbladder problems, IBS, inflammatory bowel disease, UTIs, recurring UTIs, very common. A lot of times it's assumed that that is a bacterial issue or a fungal issue, but very common for it to be parasitic. Okay. And yeah, bloating, gas, food sensitivities, okay, unexplained weight loss, anal itching, the rashes, the hives, the eczema. Okay, so lots and lots of symptoms could be tied back to parasites. On that note, okay, just because you might have one or all of those symptoms doesn't necessarily mean it is a parasite, but it certainly can be. Okay. And so in our clinic, we have observed some pretty remarkable things. Okay. First of all, the fact that parasites are linked to all of those diagnoses that I listed way in the beginning of our presentation, that's actually not something that's well known out there. Let's say in a mainstream kind of sense. But it's something that we have observed in our clinical practice. Even in my PhD work, which was on the topic chronic pain, we noticed this with the 5 chronic pain conditions that I did my research on. It was very common to find parasites involved with all of those situations. So, in our clinical practice over the past, like 15 years or so, it's a pattern that we've seen. Okay. And so this is why we know that there's something bigger going on here. And there's definitely bigger connections with these illnesses that have been grossly overlooked. Right now, and it's not just in my practice, this is also something when you talk to colleagues and stuff like that in the holistic medical world from around the world too. I have a lot of colleagues in Europe, in the US, and a little bit all over the place. This is something that they strongly concur with. So there's a lot to it. And these are some cases that we put up here. These are some cases where we observe very strong correlations between doing a parasite cleanse and then the remission of some pretty serious stuff. Okay. And even Yasmin's case, right? I'm not sure how many people here listening are familiar with Yasmin's case, but when we met, she had severe debilitating case of an autoimmune eczema. And she was covered with eczema head to toe and oozing and bleeding, open wounds all over her body. She was often wrapped like a mummy. It was a very serious case. Lots of weight loss, heart issues, severe anxiety. She developed a food disorder, didn't know what to eat anymore. So anyways, a lot of pretty serious situation. Now, in her case, there was a lot to it. There was a lot of components. It wasn't just a parasitic situation, but the parasites were a massive, massive piece of that puzzle. Huge. Okay. She was passing visible worms in the toilet for a couple of years. Okay. A couple of years straight. This was one of the most complex parasite cases that I had ever worked with. We kept her pretty much on antiparasitics like daily for the first couple of years. Okay, like for like 2 years straight. And then it was like on and off. And even until now, we still kind of circle back to parasite cleanses and stuff for maintenance. But yeah, that was incredibly challenging of a case. But for those of you who know her now, she is completely free of this eczema, right? Her skin is doing amazing. She's gained healthy weight. She's strong. She's, got her stamina back, her endurance. She's been exercising and trying to kind of increase the intensity of her exercising. Uh, she's sleeping well now. She used to she was like pretty much an insomniac at the time. She couldn't sleep, through the night. She sleeps, wonderfully well now. Her mood, everything is kind of coming together, right? And it was a huge part, there's no question. Okay. And we've seen many cases, all kinds, anxiety cases. I've seen plenty of them respond almost immediately to a parasite cleanse. My case, it literally took days and I stopped having anxiety attacks within days. Okay. So it can happen very, very fast, like the remission of symptoms once you start working on this. Um, what else here? Bladder spasms and constant UTIs, and a 4-year-old that the doctor was just kind of dismissed as a nervous bladder. And we treated parasite and things got better very quickly. Okay. We had a case of a truck driver, that was mysteriously having, a lot of blood in his urine. He was literally peeing blood and they couldn't figure out why. Okay. They did every kind of test in the hospital. They could not figure out why. Um, he was getting severe headaches. He was fainting. He was having huge cysts on his scalp, massive. I'm not talking about small things here. I'm talking about golf ball size cysts. Um, they told him he was the image of perfect health. And how many times have we seen that in our clinic? It is disgusting how many times we've seen that in our clinic from people with severe, severe conditions. They feel like they're dying. They look like they're dying. And they're being told by medical doctors in the mainstream that they're the image of perfect health. Now, I think anyone with some sense will know, that that is not true, and that is definitely not the case. And medicine traditionally would never, look at somebody in that condition and say something like that. Um, Unfortunately, with the advancement of medicine, there's a lot of good, but there's also a lot of bad. Okay. And one of the bad sides is there's this progressive um, inclination towards, if it's not justified or proven uh, based on the lab test, then it doesn't exist. Okay. Which is not a good innovation in the medical field. All right. It creates situations where people have very, very serious stuff going on and they do not get taken seriously. A lot of gaslighting occurs, and they're just left out there to fend for themselves. No treatment, no support, no answers, nothing. And anyhow, we treated this man, and happy to say that the cysts went away. The headaches went away, the blood in the urine went away, his energy went right up, no more fainting, he got color back into his face, started exercising and playing sports and all these types of things and got his life back, right? So yeah, it's quite incredible, what can happen, when you get to the root of the problem and you treat it. In this case, these are all, parasite cases, chronic BV. Okay, bacterial vaginosis, very serious problem. We had many, many cases where women were taking antibiotics weekly for this, which is very bad. Okay, taking antibiotics even once is a big problem. I'm not going to give you scary statistics about it because I don't want you to be paranoid, but it's not good to be taking antibiotics. You take it when it's absolutely necessary, of course, right? It could be life-saving. But when you have a situation like this, obviously there's a bigger problem. You should never be in a situation where you need antibiotics every single week. Okay. They're obviously missing the boat here. And they certainly were in these cases. We basically found there was a parasite triggering the recurring infections. Okay. We treated the parasite and the BV stopped. Right. So And we didn't just see this once, we saw this many times. And many times it turned out to be a parasite that was the real culprit. So yeah, that was very eye-opening too. We discover very interesting things in our work. It's quite remarkable. Okay, MS, very serious condition. We've noticed a patient, her lesions, they couldn't find her lesions in imaging. Okay, there was lesions that start to disappear after being treated for parasites. Endometriosis, PCOS, abdominal pain, a lot of menstrual issues, these types of things in women. Very, very common, almost to the point where I might say that if you have endometriosis, if you have menstrual issues like chronic menstrual issues, PCOS, these types of things, you more than likely have a parasite as part of the problem. Not necessarily the full problem, but you probably have, an issue with parasites. Okay. Alrighty, moving on. Um, yeah, basically, like I said, how many mystery illnesses or idiopathic symptoms might be in part linked or at least made worse by these parasitic infections? Based on our research, I'd say a ton. All right, the medical tests, how do you find them? Okay, how do you find these guys? Okay, traditionally, you can use stool samples. Okay, blood work, urine samples, sputum using different forms of body fluid, tissue biopsies, x-rays. We showed you a photo in the news of a CAT scan before, colonoscopies, endoscopies. All of these are traditional ways of looking for this stuff. So it's not like there aren't tools out there. The bigger issue is, especially in our medical system in Canada, is they don't really know what they're looking for. They don't know how to sample these things at the right time and the right way and stuff like that. So there's a lot of details they miss that lead to these negative test results. And there's also a lot of tests here that you'll never see doctors here ever talk about or order for you and stuff like that. If you ask them for it, they might look at you cross-eyed. Again, there's a lack of education on the topic. Huge in the medical field. So they don't even use all the tools at their disposal. And to be honest, there's a lot of these tools that aren't really a thing in Canada at all for parasites. Okay. So, but anyhow, we just want you to know that these are kind of the traditional ways that exist. This is kind of just even on public health and stuff, they have instructions on how to properly collect stool samples, which is rare that you'll find, doctors do this according to public health. But anyway, there is a protocol. If they did it properly, it would help, but not always. Which brings me to my next slide. Why don't they always show up in stool samples? Okay. Now, the reason is because they infect more than just the intestines. Okay, so they're not always going to show up in the stool. Even when they are in the intestines, they are hooked very strongly to your intestines, so they don't willingly just jump out in the stool. That's the last place where they want to be. Okay, so and then to our point here, if they're in your brain, they're not going to come out in your poop. If they're in your muscles, if they're in your lymph, if you're in your eyeball, if they're, in your blood, they're not coming out through the other end. Okay. So you're not going to find it there. So when you have doctors that say, okay, well, we did a stool test, it wasn't there, therefore you don't have it, this is something you need to keep in mind. One, it's a very limited test. Two, they don't really know what they're looking for. Three, they're not collecting the samples properly. And then, I don't know what I'm at here, 4 or 5. And they're not necessarily in the stool. They could be anywhere. Okay, so that takes me then to the alternatives. All right. Now, in holistic medicine and natural medicine, naturopathic medicine, whatever you want to call it, there are some additional tools available. Okay, there's more comprehensive stool tests that exist, which are more effective at IDing these guys. We have dark field microscopy, which is, anyways, it's a type of live blood cell analysis that can also see some parasites or the signs of the effects of parasites on the body, okay, which could be a useful tool. There's DNA sequencing, bioenergetic testing, more specifically here, electrodermal type screening. This involves basically sending electrical signals through the body, and picking up on basically the frequencies associated with parasite infections. Okay, so when we think of the body in a quantum physics sense, everything in the body is made up of energy. Everything, therefore, has a frequency that's measurable. And these are machines that can detect, frequencies that shouldn't be there, or frequencies of parasites or certain types of parasites that are creating problems. Okay. Um, so anyhow, it's an interesting kind of tool that can also be, helpful and insightful. And then there's also thermography, which is, getting more popularity. It can be used for a lot of different applications in assessing health, and involves looking at heat patterns that are changing in the body. So this can be very useful to find pockets of infection that are kind of hidden or you can't see it otherwise with other types of tests. So it's quite interesting. And then, of course, the best one for last here is the muscle test. Okay, that is my favorite one. That's my go-to. Okay, I personally don't really use the other ones. I'm aware of them. I have access to them. I've never had a case where I've had to use the other ones. The downside is they tend to be very expensive. Um, Other downside is even if it does happen to pick up on a parasite in the test, how you go about it is a whole other story, right? It's so it can be informative, but it can also leave you kind of hanging with, okay, now that I know it's there, what do I do with it? Okay, so it has its benefits, but also its limitations. Now with muscle testing, especially how we use it in our clinic, okay, which is going to be different from how you might see it being used in other places. Okay, part of the reason is because the protocol that I use with muscle testing is something that has been developed right here. Okay, I've developed it over 20 years. Okay, so there's going to be it's unique. All right, it's unique in terms of its approach. So, and it overcomes a lot of barriers. Okay, it overcomes a lot of limitations from other tests. We can detect whether or not the parasites are there rather relatively quickly, but most importantly, we can find the species. We can also determine whether or not we should treat it. Okay, because that, like I had said earlier, becomes the big question. We already know you have parasites, but do you need treatment for them? Or are they causing a problem? Okay, not only that, but part of treating parasites, as we'll learn very shortly, involves, not just the parasite kill. That's one phase of the whole process. And you may not want to start there. Okay. So with muscle testing and specifically my protocol, we can determine what phase in the whole healing process you're at so that we can determine whether is it safe right now to do this parasite kill or do we have to do some prep work first. So these are all things that are possible with muscle testing that's not possible with the other approaches. So anyways, it's quite an amazing tool. My favorite tool. If you've had a session with me, we use muscle testing in every single session. And yeah, anyhow, um, it's good. Okay. So remedies. As I said, this I expected to be the kind of favorite part for people to learn about because when you find out you have a parasite or you suspect you do, I think the only thing that you have at the back of your mind is how do I kill them? Okay, so here are your weapons. But first, starting with a quiz, can anybody recognize this tree? And there's a purpose. It's okay that this is relevant to the whole to the whole presentation. Okay, it's not just a random quiz. All right, can you identify this tree? Okay. All right, so how about now? This is a clue before I give the answer. So this comes from that tree. Okay, you might notice this. walking in your neighborhood or into a park or something like that, these green looking things that fall. Okay, they eventually turn like very dark brown and even black and stuff. They can stain the sidewalk. If you touch them with your hands, they can really stain your hands and things. All right, so I'm giving the answer now. It is black walnut. So those guys that you maybe have seen and just kind of ignored or kicked or whatever, this is very powerful medicine. Okay, there's actually a walnuts in there. Okay, so there's the green part is the husks, which in this photo they're kind of oxidized now, so they're more brownish black. And then there's a very hard shell in the middle, and if you manage to crack that open, you get some beautiful walnuts. Okay, and this is very traditional medicine. Okay, Native Americans use it, First Nations. This is native to Canada. We have these trees all over the place. And they're used in natural medicine for lots of applications. And as an anti-parasitic, they're also used for like detox support. It can be used as an antiviral. It can be used for a lot of things. It's a great, great medicine. And it's always incredible to me how surrounded we are with medicine and how we just ignore it because we don't know, like, right? No one ever teaches us about this stuff. And I think it's a shame because there's medicines all around us, very potent, amazing medicines. This is just a little bit of the nitty gritty in terms of some of the um, medicinal compounds found in black walnut and some of the common things it's used against in the parasite world and whatever. But anyway, it's one of our favorites. It's a top one that comes up in sessions that people test really well for. And yeah, just wanted to have that little bit of fun there with you guys. Okay, so the strategies, and we are going to go over some like a more extensive list of remedies and stuff like that, but we wanted to walk you through kind of things in order. Okay, so first of all, the first step in all of this would be to ask yourself a couple of questions. As to whether or not you're ready for a parasite cleanse, or if it's safe for you to be doing a parasite cleanse, or to help you kind of discern, should I be doing this? Is it safe for me to do this on my own? Can I do this on my own? Or am I in a situation where I need some professional guidance? Okay, so um, now so anyways, if you're pregnant, as an example, am I pregnant or breastfeeding? If you answer yes to this question, okay, do not do a parasite cleanse. Okay, that is probably one of the only contraindications to parasite cleanses altogether, or pregnancy. Okay. Aside from that, do you have an autoimmune disease? Do you have severe allergies? Are you prone to anaphylaxis? Do you have a lot of food allergies? What is your current diet and lifestyle like? Is it very poor? Is your health overall very poor? Do you have any diagnosis? Okay. Um, are you able to sweat? There's a lot of people that can't sweat, and that's a big problem because it's a major detox pathway. Okay. So these are a few things that you kind of just want to, and we've added this list to the handout, so you don't have to remember everything here, but it's just, we want to kind of put in your head that you don't just want to jump into parasite cleansing. Okay, there's certain requirements that you should meet before you decide to do this on your own. Okay, and in many cases, you'll want to, if you have a pretty severe situation going on, or a complex health condition, or whatever, you might want to work with a professional. Okay, so that it can be done properly and safely. Okay, so there's basically three strategies, broad strategies when it comes to dealing with parasites. The first one, would be supporting the immune system in dealing with the parasites itself. Okay, so strengthening your body to do what it's already supposed to do. Okay, so that in itself can be a strategy. And sometimes it's a very good one. We do this all the time in clinic. And this doesn't involve you having to use special parasite killing supplements or whatever. um, because the immune system takes care of it on its own. Okay, so that's an interesting point of view. A lot of people don't actually talk about this when they talk about parasite cleansing and stuff like that. But this is a very valid approach. Okay, the second approach would be to specifically target the parasites and then use antiparasitics. Okay, whether it's using medicines or natural medicines, pharmaceuticals, or whatever, or even specific diet changes that specifically target the parasites because there's anti-parasitic foods and so on. Okay, so that would be number two. Number three would be to combine those two together. Okay, this is probably the most common that we see in our clinic is the combination of both. Okay, giving the immune support so the immune system can deal with it, and then targeting the parasites directly. This is often the most efficient approach. It also helps to prevent future parasite infections because you're dealing with the weaknesses in the system that allow these parasites to grow in the first place. Okay, so it's probably the most common one we see, but all three can be very good strategies. Again, it's a very individual thing as to which we'll use. Okay. So then that takes me into the phases of parasite cleansing. Okay, so we said before that it doesn't mean a parasite cleanse is not synonymous with just kill them. Okay, I mean that's what most people think, and that's what they want to jump to because they're grossed out and they just want it out of their bodies and the whole deal. And I get it, I get it. But that's not necessarily where you're going to start. Okay. You need to take the whole context into account, and it's very important. So I hope I do a good job here at breaking this down. Um, Step one, okay, you want to have a plan. Okay. You want to plan out this protocol. Okay. So you want to be able to identify what you're dealing with. And that could mean that you're dealing with a parasite. It could mean, am I dealing with what parasites am I dealing with, like what species? Um, when am I going to, or first of all, like when do I suspect I would have kind of picked this up, this infection? How far back are we talking here? Okay, some people have symptoms suggesting parasite infections, that goes back years, okay, many years. So how long do you think, you've had this issue? When do you want to start the cleanse? Okay, so those are like two when questions, and how am I going to cleanse? Am I going to focus on strategy one and build my immune system? Am I focusing on strategy two, just kill them? Am I focusing on strategy three, let's do both? Or am I going to kind of, go through the whole phases of parasite cleansing? Am I going to do this on my own? Am I going to get professional help? Right? So you want to have a plan. You want to know what you're doing, what you're dealing with, what you're getting into. How bad are we talking of a parasite issue? This is going to influence your decisions here on how you're going to approach this. Next step here would be to prepare yourself. Okay, and here we're talking about preparing the body. Okay, and the mind. Okay, preparing the body and preparing the mind. And you can do this by eliminating some pretty key things. These are the foods that feed parasites. So if you start by eliminating this, you're going to start to weaken them. That's very important to this whole process. You want them as weak as possible. Okay, they are very tricky creatures to treat. They're very well adaptable. They adapt well to all kinds of conditions. You want to use every tool at your disposal. So we want to exploit their weaknesses. You want to eliminate dairy products, sugar. Again, here are the bad types of sugar, alcohol, raw meats, sushi, all that kind of stuff. You want to put an end to that for a while before you decide to do the actual kill phase. Okay. And by a while, I mean like a month at least. I know, a month without dairy products. How dare you? I want my money back. All right. Um, then you want to open up the detox pathways. Okay, so I mean, if you don't know real quick, your detox pathways mean you're peeing properly. Okay, you're going to the bathroom for number two properly, you're pooping properly. Okay, that's a major detox pathway. You're sweating. Spoke about sweat before. You need to be able to sweat. That's another detox pathway. So, want to make sure you're detoxing properly. They're open. If you're constipated, you definitely don't want to start killing parasites because all those toxins, where are they going to go? They're just going to recirculate in your body and make you very ill, okay, and violently ill in some cases. So you do not want to parasite cleanse if you are constipated. So you want to make sure that the detox pathways are open. You want to increase your hydration. You want to make sure you're sleeping properly, or at least start setting up a proper routine to get rest. Um, you want to have daily bowel movements. You want to be doing some daily movement. You want to make sure you're sweating, you're able to sweat, and you're actually sweating so you can, actively be detoxing. Okay. You want to improve mitochondrial function. Okay. In other words, you want to make sure your cells are producing enough energy to support the cleanse. Okay. A lot of people are burnt out. They have adrenal fatigue, and which happens to be one of those things that parasites take advantage of, and then they're wondering why they keep getting reinfected or why the parasite cleanses aren't working. This is a big reason. If your mitochondria aren't producing enough energy, your immune system will crash. You're going to have a weak immune system. You're not going to be detoxing efficiently. You're not going to be repairing your tissues. It's going to be a big mess. Okay, so we need to make sure we're improving mitochondrial function prior to the whole thing. And this is primarily done nutritionally, with the proper diet, with the right supplementation, and with it getting enough rest and nervous system regulation. Okay, reducing stress factors. Okay, regulating the nervous system, mind-body techniques, different things. Okay. The next phase, all right, finally, the kill phase. This is where you're going to select your herbs, okay, your nutrients, your supplements, your spices, whatever we decide to use. It could be even a pharmaceutical, technically, okay, or a combination of. All right, so this is where you're going to make those selections. You're also looking here to remove the toxins. We spoke about the toxins. This is equally important to the whole process. The toxins is what gives all the symptoms in the first place. Okay. This is what's making you ill in the first place. So you need to make sure you're not just taking out the parasite, but you're taking out the toxins. Okay. And we're talking all kinds of toxins, including radiation, toxic metals, chemicals, ammonia, all kinds of stuff. Okay, because it's not like these parasites, they absorb and they hold on to all kinds of stuff, all kinds of toxins. So they're going to release a whole bunch of mess as you kill them. We also want to remove and continue to reduce and remove stress and all the different stress factors, whether we're talking about emotional stress, physical stress, environmental stress. This is huge. This is very important. Okay, it's very important that this is really well managed to be successful with a parasite cleanse. It's actually a big reason to why people get parasites is chronic stress, right? Which we spoke about. Crashes your adrenals, crashes your immune system, makes you very weak. Okay. There's also another aspect to this, which you may not hear anywhere else, so I'll mention it. This is a mind-body, more holistic concept of how, let's say, toxic relationships or environments also energetically make you very prone to parasite infections. Okay, so when you're in relationships with people that are kind of like parasitic in nature, in the sense that they take from you, they take your energy, they take your resources, whatever, and they don't give anything back. They deplete you, in other words. These are toxic relationships, and they can sometimes be abusive relationships. And without a doubt, we notice that people in these types of relationships are extremely prone to parasites. And there is a very strong basis to this. And we're not the only ones who have observed this. We also have many colleagues who have observed the same phenomenon, but it's a pretty serious issue. We've also seen cases where people were in these types of relationships, and when they finally started to set boundaries, okay, when they finally said no, okay, and they set boundaries for themselves, let's say they enhanced or strengthened their emotional immune system. Okay, they identified, hey, this person is a problem. They are, we need to put some boundaries here. We've also seen cases like that where their immune system almost immediately switched on, and within like 24 hours, they started passing visible worms. Okay, and lots of them. Okay, it was as if by putting that emotional immune system up, it allowed the actual immune system of the body to function better and to start killing parasites. So part of parasite cleansing is not just to deal with the kind of microbial parasites or the biological parasites, but it's also to a large degree a process of removing parasites in your environment. Okay, and I'm not talking about the microbial type anymore. I'm talking about people. I'm talking about not even just people. I'm talking about toxic environments. It could be a work environment. It could be a house environment. It could be whatever. Anytime you find yourself in situations where you feel depleted, whether it's a relationship, family, friends, or so-called friends, or whatever, colleagues at work, bosses, um, these are all things you need to seriously look at too. Okay, because your emotion, your environment is a big part of you. Okay, it's an extension of you, and so it's part of what you have to clean up also. All right, in order to really heal. Okay, and this is going to be a very difficult part. First of all, to see it, and then second of all, to take action and set those boundaries and make those life changes. But it's critical. It's critical. So I want to mention it because all too often everyone's so focused on the worms inside that they're not seeing that they have bigger issues outside of them that are weakening their whole immune system, their energy, their life force, okay, their chi, okay. And when your chi is low, when your life force is low, this will make you so prone to illness. Okay, not just parasites, but just about every illness is linked to having low chi in the body. When your life force gets depleted, you become a magnet for disease. So it's very important that you pay attention to this. All right, moving on. The repair phase. Okay, we want to repair the tissues. We need to repair the damage that's been left behind from these hooligans. Okay, so I put a couple of nutrients here, and I do so very hesitantly because I don't want people running and just grabbing them off the shelf and self-medicating with these things and stuff, even if it's natural, even if you've heard other people talk about this, whatever. It doesn't mean you need it. It doesn't mean it'll be good for you. It doesn't mean it'll be safe for you. Okay, so just take it with a grain of salt. I'm just putting out there that there are nutrients that help with repair. These are some common ones that come up, but it could be a lot of other things. Okay. And you may or may not need, those nutrients at all. Sometimes you'll just use food to do the repair. But anyhow, this is an important phase to rebuild, repair. Okay. And this means your tissues, this means your immune system, make sure it's as strong as possible, etc. All right, finally, you want to replace what was taken away. Okay, so if you have a lot of bacteria that kind of got displaced because of these parasites, so your good probiotics and stuff, you may have to replenish the probiotics. Okay, you might also have to deal with now those chronic deficiencies, like we spoke about earlier, the iron, which is very common with parasites. This is the time now where you can now put the iron back in. Okay, it's not the time to put iron before your cleanse or while you're doing the cleanse, because that may very well just feed the parasite and make it strong. Okay, so now this is the place to do it, taking care of those deficiencies. And you also want to replace the bad habits and lifestyle factors and all those things that got you in that mess in the first place, right? So noticing here hygiene spelled wrong, Yasmin. Or no, is it? Oh my gosh, now I don't know. Before I throw her under the bus, now I've got myself questioning. Anyways, maybe it's not. Um, replace, yeah, so replacing all that stuff. Okay, moving on. Um, bio-individuality. Right. So another important point I wanted to make here is no two parasite cleanses are going to look exactly the same. Okay. We try to break this down as much as possible in a way that you could follow a process that's pretty standard. Um, Even though it's a situation that's not inherently standard. Okay. Because everyone is so different. Um, so I just wanted to point that out. Okay. We treat a lot of parasite cases every week, pretty much daily. Someone's coming in with a parasite case that we have to deal with. Okay. And everyone's case looks a little bit different. Okay. The supplements we'll use will be different. The herbs, the probiotics, the antiparasitics will be different. The dietary approach might, it's pretty consistent, but there could be some differences. Um, and sometimes too, more importantly, is where we actually start. Okay. So, like we said before, some people are further ahead and maybe they can start with the removal phase or the kind of parasite kill. Some people, they're further behind. And so we have to start slow. We got to focus on preparing the body. Some people are actually at the end of the parasite cleanse, sometimes without realizing it. They just still feel horrible, but they actually don't have the parasite anymore because maybe they were doing something that actually got rid of it, but they still feel horrible because they haven't done the repair phase yet. Okay, or they haven't replaced the deficiencies, and so they're still suffering from the damage that it all caused, right? So everyone's a little bit different. And so the order that we work in can differ based on the person, but this is from a clinical point of view. This is when I see people, all right? Because I, with muscle testing, can determine where you're at. Okay, so I can figure out where to start and how to kind of go about. Occasionally, we'll also simultaneously work on phases. Okay, so we may have to work on phases simultaneously or cycle in and out of them. So these are more complicated strategies that, it's a practitioner thing to deal with, not you. I just wanted to kind of, point that out. I just want you to let you know what we do different in clinic versus, a standard protocol you might do at home. All righty, so um, examples of some influencing factors. We gave some already. There might be a few other ones here we didn't talk about yet. But recent stress, chronic stress, major life changes, anything stress related can affect your immune system, make you vulnerable to parasite infections. Um, Even if you don't come in contact with anything new in that time, it could be you just have the kind of parasites already in your system, but now they overgrow because there's no immune system to keep them in check. Okay. So these can be things that you've had for years. Okay. But now they cause a problem because of the recent stress event. Okay. That tanks your immune system. Okay. So that's a factor. Okay. Having tooth infections, root canals, big problem. Okay. Root canals will be a webinar probably on its own at some point because it's such a huge issue. Um, if you did a recent round of antibiotics, okay, totally disrupting the microbiome, you pretty much wipe out the mechanisms your body has to keep these parasites in check in the first place. Sorry, so this is yeah, that could be a big issue or trigger in itself. Pregnancy, and we're talking here just the how depleted women will get through pregnancy could be a big factor. Okay. And also just the fact that those little kids, once they are out in the world, if you don't manage to catch a parasite on your own, they will almost guarantee that you will because they'll give it to you. Okay. Big physical injuries, again, big stresses on the body and stuff like that. Adrenal fatigue. Okay, if you're burnt out, you're super vulnerable. Okay, and we spoke about the toxic relationships. All right, pharmaceutical options. There are pharmaceuticals out there. It's not that they don't exist, because most of the world knows very well that parasites are a big problem. It just seems that the more modern parts of the world just dismiss it. But there's amazing anti-parasitic medications like pharmaceuticals that exist and that are used routinely in many parts of the world and very effective. But we don't have access or easy access to most of these. Okay. And even the ones we do, most medical doctors who can prescribe them don't know how to prescribe them, so they just don't. So that leaves us in quite a pickle when it comes to the pharmaceutical options. But we just wanted you to just know that they exist. There's a couple that exist here that are easy to get. There's even one or two over-the-counter ones you can get from the pharmacy. But anyhow, we didn't want to spend too much time on this. It was just of interest. Natural antiparasitics. Okay, this is the holy grail of the presentation. Okay, so this is a good list. There's more, out there as far as herbs and spices and stuff like that, and foods that are antiparasitic, but these are probably the more common ones. Okay, so um, you're going to get this list anyways in the handout. All right, so you don't have to write all this down or try to memorize it real quick or anything like that. You'll get this in your handout. But we wanted just to show you, that the black walnut is a very, common one. Coriander, clove. Clove is one of the only ones that actually deals with parasite eggs. Okay, so it's a very common one that's used because it really disrupts the life cycle of parasites. Garlic, garlic is a hero for most types of infections. Um, Wormwood, okay, is a classic. Okay, also one of our top go-tos, maybe one of the most popular ones too that we use. I'd say black walnut, wormwood, clove, garlic, coriander, probably the top ones we use. Yarrow, a very popular one too. Oregano, right? So these are very, very kind of go-to options when it comes to natural antiparasitics. When it comes to herbs and spices like this, they can be taken as tinctures, which make them very, very potent. Okay, the alcohol in tinctures, it bursts the cell membranes of the herbs or the spices, and that releases the full capacity or concentration of the medicinal properties, if you will. Okay, so tinctures are very traditional way of preparing medicines. Not always going to be appropriate to do a tincture. In clinic, we would test whether you need this in tincture form or an herb form or capsule or whatever. But yeah, it's not always inappropriate, but it's one of the ways that you can take it. Okay, same. You can take it as a tea. You can take it as a dried herb. Okay. Um, Now a big question people will have is, well, how do I know which one to take? Okay, well, that's the thing. Okay, and this is where getting professional help comes into play because in our clinic, we use muscle testing. That's how we know. And we know for sure because your body will tell us through the muscle test. We'll get a reaction, immediate feedback from your muscle response, how each and every antiparasitic, test, when we do our muscle testing. So it gives us a direct answer from your body, what's compatible versus what's not. We can even, nail the dosage. How much are you going to need to take to have the effect? How much is too much? How much is not enough? Right? So we can get the optimal dosage with muscle testing. We can also figure out the exact time of day that you need to take it for it to be most effective. That's something that's a big part of our research is finding the timing of taking a supplement, not just in this case, but any supplement. We test it against the circadian rhythm in the Chinese body clock, which predates the Western idea of the circadian rhythm by far, but it's basically the traditional Chinese medicine version of the internal clock. Anyhow, point is we do a lot of testing to really get very specific, okay, when it comes to supplementation. The dose, well, first of all, the actual supplement to use or combination of the specific dosage, the specific time of day, and the specific preparation, tincture, herb, whatever. So there's a lot that goes into a session, that will save people a lot of time, a lot of money, and be very efficient with the whole process. However, if you're going to do it on your own, um, I mean, the traditional way of dealing with parasites is you just use, these items. Okay, that's how traditionally people take care of themselves because muscle testing isn't widely used or known, to that degree. Right? So you would look at these options and you would kind of choose what's accessible sometimes. Some of these things may not be very accessible. Um, and you would follow the directions on the bottle. Okay, so that's an important consideration. Okay, if you're doing it on your own, you're not going to venture off and use what we call therapeutic dosages. All right, that's for a professional to advise you on. Again, even if it's natural, doesn't mean it's safe if you're taking it when you shouldn't, or if you're taking too much or for too long and stuff like that. So, if you're doing it on your own, you follow the directions on the bottle. There's also parasite products out there that combine a combination of herbs and spices, so those are options too that you may find out there. Just make sure it's a good quality. But that also exists. Okay, but again, just follow the directions on the bottles. Okay, if you're doing this on your own. But I also gave you guys kind of our top go-tos in clinic. So, and there's actually products that exist that combine them, all in one product. So yeah, if you're doing it on your own, those are options. Um, and you can improve your accuracy if you learn to develop your intuition. Okay, some of you listening to this, will be very intuitive anyways. Some of you may be a little bit new to, using your intuition to kind of figure stuff like this out. But I intend on kind of teaching this at some point because it's an invaluable tool to have, learning how to use your intuition to kind of better your health. I'm also going to be teaching a muscle testing course we'll be teaching a self muscle testing technique that you can use to see for yourself, things that test well for you or don't, including testing family members too, to see if things test compatible or not. That'll be a course that will be available for everybody. Yeah, so moving on from there, there's also anti-parasitic foods. Okay, papaya seeds are incredible. Papaya itself is very good, very common, very traditional. Pumpkin seeds, raw pumpkin seeds are excellent, very traditional as well. Excellent thing to use on a parasite cleanse. Garlic is king. Okay, using garlic is a very good option. Pineapple, coconut oil, all these things here. Again, using those herbs and the same herbs and spices that, we can take as supplements. Most of these are culinary type things that you could be using in your cooking. You'll notice a lot of cultures that deal with parasites in a very serious way. They naturally, if you look at the traditional foods, they're constantly using these spices and these herbs. Okay, turmeric, ginger, clove, cumin, thinking of all the curries and stuff, right? Garlic. These are things that are traditionally, they figured out that they have to eat like very spicy and herby foods in order to survive, right? So being inspired by that, working these things into your diets, herbs and spices, which we don't always do in Canada. And particularly too, just depending on your culture and stuff, it might not be something you're used to doing traditionally with the food you eat. So learning how to incorporate more herbs and spices is a really good thing to do for maintenance when it comes to parasites. Okay, on the topic, and I won't spend too much time here, but it's very important that you're aware of what's going on with supplements in our country. The government is for decades now has been trying to remove access to natural health products in Canada. This is also happening in Europe and the US. where there's a lot of push from pharmaceutical industries to gain full control over the natural health world. And I know that sounds contradictory and stuff because, this is precisely the world that has been downplaying the effectiveness of natural medicines for just about ever. And many doctors that, mainstream doctors will roll their eyes at you when you talk about natural medicine. And, when you talk holistic medicine, they spit on it and they're very sometimes rude and arrogant about it, and talk down about it. I've also heard politicians and health officials publicly denounce nutrition and all these types of things. But the reality is, behind the scenes, they know very well that that's the future of medicine is natural. Okay, these herbs, these spices, probiotics, vitamins, minerals, coenzymes, amino acids, all the different types of nutrients. That is key to solving chronic illness. Okay, it's one of the reasons we're so successful in our clinic is because we're using the actual things that help people heal. Okay. And that's why the field in general is very successful because these are very potent natural medicines that help people heal, right? It's not, pharmaceuticals have their role and their place, there's no question. Um, and but when it comes to chronic illness, the healing process happens with real nutrition. So anyhow, that being said, there's another sneaky bill that has just been passed. Again, the aim is to reduce access for us to get supplements. And it's just for you to be aware. Okay, the last couple of times they've done this at a government level, they lost. We have a very good legal team working with our nutritional association that monitors this type of activity, and they fight and advocate on all our behalf. If you want more information about this, the nhppa.org is the place to go for all the updates on this, because you will not hear about this in the mainstream news. This is something that's been heavily censored, heavily censored. So yeah, please be aware that this is a thing, and we're all fighting for you, and we have a lot of good people that are fighting for you and stuff. So but just be aware that this is what's going on. This is another attempt that they're making, and the bill did pass, which is going to basically affect the manufacturing process. They're trying to basically regulate natural medicines as pharmaceuticals, which are going to create extremely high regulatory fees for companies, and basically they're trying to like squash them out of the market. So it's a bit of a different approach than in the past, but it's going to be the same effect if this really goes through. So anyhow, be aware if there's something that if you feel called to advocate, this is the website to go and look at, nhppa.org, get all the information there. They have templates to contact your MPs, all that kind of stuff, and they'll keep you posted on the best way that you can help. So just so you're aware. Okay, so I think we made clear the difference between therapeutic parasite cleanses, which is done with me or a practitioner, which has a little bit more details and nuances involved with it, versus the kind of more standard maintenance strategy we've presented, okay, with our phases that you would work through in order, okay? Again, one of the reasons we differentiate between these two kind of situations is because of this guy. He discovered the idea of the Herxheimer reaction based on his name there. Because when you do a parasite cleanse, there's a lot of toxins that get released back into the body. And that creates what we call a herx reaction or a Herxheimer reaction or a die-off reaction or a detox reaction, however you want to call it. And it can create extremely bad symptoms, okay? It can make all your symptoms worse. It can create new symptoms. It can make you feel awful. So this is why we want to avoid you going through this, okay? And that's why we had those screening questions at the start, okay, to help you figure out, is it safe to do this kind of on my own? And if so, then you really follow the procedure that we've outlined with all those phases. And it's very important that you do so. Okay. Don't get overconfident or overexcited and want to just go to the kill part. And, there's a reason why we designed it that way. Okay. There's a reason why we created those phases to make sure you do this in the safest way possible. And it's to make sure you don't run into trouble. And it's not a matter either of saying, oh, well, I'm a tough person, so I'm just going to power through it because I'm sick and tired of this thing. I just want it done. No, you can cause more damage. That's the point. You can cause more harm. Toxins are not a good thing. You want to make sure that there's a way for them to exit the body safely. You don't want them to get stuck in the tissues. You don't want it to keep recirculating because you're just going to cause more problems, right? So it's very important if you're doing the maintenance version of this at home, follow our outline. Okay, it's all in the handout. Okay, follow it carefully. If you have questions, email us. We'll be happy to help if you need clarification on anything, right? But follow the procedure, and this will go just fine. But that is why there's a therapeutic version. We work with a practitioner so we can help you avoid this problem. Okay, when we do parasite cleanses the right way, you shouldn't really have much of a die-off effect. Sometimes people will have a few days of symptoms. Sometimes in more serious cases, it's pretty bad symptoms, but usually it goes away after a few days. We've had cases where it's been worse than that, but we had to kind of, anyways, compromise a little bit because of how serious the case was and stuff like that. But there was a little bit more these die-off reactions that lasted more like a week, 2 weeks and things. But we monitor and support those cases carefully to make sure that, they're being well taken care of. Okay. So, yeah, just wanted to bring that to your attention. Real quick, this is just, some for those that are very interested in the sciencey part of how these parasites do their stuff. Biofilm is something that parasites create to kind of create nests, if you will, okay, of that promote their growth. Okay, it helps to protect them, helps to create a cozy environment for them in the body and stuff like that. So it can be kind of a sticky, gooey, kind of mucusy, blobby looking thing or whatever. But it's also part of this whole process of cleansing is, taking out the parasites, but also breaking apart this biofilm, which is like their nests, okay? Because that can also, if you leave that behind, there can be some stuff, eggs, parasite eggs or whatever kind of stuck in there, or toxins or stuff like that. So the types of supplements, the herbs, the spices, the foods, the activity, all the stuff we recommend, it's all part of a bigger protocol here to make sure that you're dealing with the parasites, you're dealing with the detox, you're dealing with the biofilm, so that you really have an in-depth cleaning, so that they don't come back. Okay, so it's a big consideration too. And in clinic, we sometimes use very specific things for this, but in a general sense, if you don't have a serious situation, this should be dealt with pretty easily with the approach we've recommended. Okay, this is we also have an article on our website that goes deeper into the whole science behind the Herx reactions and how this happens, and all that kind of stuff, and how when you start breaking down biofilm, it can release stuff back into the system and blah blah blah. So yeah, if you're interested in the more in-depth version of that conversation, our website has the article there for free. All right, so again, for prevention, okay, and this takes us near the end here of the presentation. For prevention, the 5 root causes of disease webinars are a great go-to, okay? Now, we covered a lot of things in this kind of webinar today as far as the things that you need to do to really support yourself, okay? All included in the handout, all included in their discussion of the phases of the parasite cleanse. If you follow those phases very well, you're going to be tackling all of these 5 areas in a pretty good way. But again, because of time limitations, and we don't want to overwhelm you either with all kinds of information and stuff. And, again, our goal was to try and come up with a simple but very effective protocol that you can follow if you plan on doing it on your own. So we don't have every possible detail, in there. But if you look at these webinars, you will get the details. Okay. So this is a whole wealth of information on its own with very practical tools, tips, information that we shared very in depth. I really recommend it. Okay. Very, very good follow-up to this webinar. And of course, hygiene. Yeah, I knew she had spelt it wrong. I knew it's because before it was she had EI and it's supposed to be IE. See, I knew it. I called her out on it. There you go. I thought I was going crazy, but nope, I got it. All right. Anyways, in watching to clean well under the nails, it's such a common spot as to where the eggs go. Okay. So yeah, being mindful of hygiene, hand washing, all the deals, right? So finally, parasites are everywhere. We've learned that. We've confirmed it with all our quizzes and stuff. Hopefully you did okay on the quizzes. And hopefully they didn't stress you out too much and you did well. Uh, I think, I don't just think, I know it's an underexplored factor behind chronic symptoms. And now I hope you know that and it makes sense. You now have the knowledge to protect yourself. Okay, you now know a lot more than most health professionals in at least the country. And to be honest, the depth we went into today, you knew more about parasites now than most health professionals. Period. Okay, that's a fact. And I hope you can now put that into good use so that you can start to improve, your life, perhaps life of family members that you might suspect have a problem. Um, and yeah, and do it the right way because I know there's a lot of information out there. And again, one of our goals was to dispel a lot of the myths or kind of misinformation, I guess, that you would find on social media and stuff about these things. So we wanted to give you a reliable source of information on how this all works and how to do it right and the why behind it. We spoke about the difference between doing it at home as a maintenance type protocol, okay, versus doing it as a more of a therapeutic protocol that involves a little bit more nuance and more specificity with the approach and the supplements used and the dosing and all that kind of stuff. And we spoke about the prevention strategies. All right, so you will be receiving the parasite guide, the handout, okay? And if you have questions beyond what we've included in that handout, feel free to email us, but I think it should have everything you need, okay? But yeah, let us know if you need any support aside from that. All right, special thank you to Yasmin. She put this whole presentation together. She worked really hard over a good 3 months to get this all prepared. She made it a very stunningly beautiful presentation. And she spent a lot of time doing extra research to get all these fun facts and information and statistics and all the deal, diagrams, all this beautiful information that she thought you guys would appreciate. And so I know I'm extremely grateful for all of her help in putting this together. And I hope you guys are appreciative as well and grateful for her hard work and all the like. But yeah, if you need to contact us, all of our contact info is here, our website, phone number. These are our social media pages. I hope you follow us there if you really want to continue the learning process, if you liked what you heard and saw today. Follow us on social media. Yasmin does a great job posting almost daily. And so that's a good way to continue the whole learning process. Okay, not just on parasites, but on everything holistic related. Okay, our upcoming course will be on muscle testing. I hope you can join us. If by the time you see this webinar, we're past November, check out our website because we will be having regular meetings for our muscle testing course. I'll be doing it several I'll be doing it ongoing for, surely the years to come. So you can always check out to see when the next course will be given. Alrighty. So that takes us to the end. Thank you guys again so much for joining. I hope you found that informative. I hope it makes a difference in your life, and hope that you will join us for, our events again sometime soon. Take care, guys.